what exactly happens in the body during an allergic rhinitis flare-up? And is it seen more on a seasonal basis or an all year round kind of thing?
Yeah, so allergic rhinitis happens when the immune system has an overreaction to something that's normally harmless, such as pollen, grass, dust, pet dander. And when the allergen enters the body, usually through the nose, it causes the body to treat it as a foreign object rather than something that's safe. So the body goes into a sort of protective mechanism, releases histamine, and the histamine is the thing that causes all the symptoms of allergic rhinitis. And that would be swelling of the nasal lining, which leads to blockage of the nose, a runny nose, eye itching, eye watering, sneezing, and inflammation in general. So, in essence, what happens in the body is that it is a reaction, an abnormal reaction to something that usually the body would not have an abnormal reaction to. Now, with regards to it being seasonally or perennially, which means throughout the year, it really depends on what we're allergic to. So some allergens have a seasonal um, high levels. So such, for example, tree pollen is highest in spring. In the summer, it's grass pollen, and in the autumn, it's weed pollen. Uh, and so patients who have a specific allergy to these pollens that are seasonal will have the symptoms at the highest levels during those seasons where the pollen is, or the specific pollen is at the highest levels. However, if somebody is allergic to something that's in the air constantly, such as dust, such as pet dander, dog dander, cat dander, mold, then the symptoms can last throughout the year and is known as perennial allergic rhinitis. So the difference between a common cold and allergic rhinitis can sometimes be confused. A common cold usually comes on uh, within about a few days and can last a week or two, and it's associated with feeling unwell, with a sore throat, sometimes with some difficulty swallowing, body aches, fevers, and with regards to the nose and sinuses, you tend to feel very congested and have pain in your sinuses, and you can have a thick green or yellow mucus that comes out, which is opposed to allergic rhinitis, which is something that happens over a longer period of time. However, it happens quickly after onset of exposure to a symptom. So, for example, if you're allergic to dust, you may get the symptoms immediately, but the symptoms may prolong for several days. And rather than feeling unwell and having fevers and body aches, you tend to have topical symptoms. So, blocked nose, runny nose, sneezing, itching, eye symptoms. But really, the itchy nose, the itching eyes, and the sneezing are the giveaway.
Oh, fantastic. It's interesting to know the difference, actually. Thank you, Mr. Advani. So, Mr. Advani, we hear a lot about antihistamines and nasal sprays, but are there any surgeries that can help patients or long-term solutions or lifestyle changes that can help?
Yes, absolutely. So I tend to look at allergy as a stepwise progressive treatment pathway. So the first step is always prevention of exposure to allergens. And there's very, very good information out there. And one great website is Allergy UK, which will tell you for specific allergens how to best avoid them. And I'll give you an example. So for house dust mite, the three top things in order to improve your allergies in terms of lifestyle changes would be to use protective dust mite proof covers on your pillowcases and on your mattress, and that prevents the house dust mite from getting in there and living in your bedding. Secondly, washing your bedding at 60 degrees once a week or on a weekly basis. This helps clean the bedding and kill the house dust mites, essentially, that have been living there. And finally, reducing the humidity to below 50%. So using a dehumidifier or good ventilation makes the environment not so suitable for house dust mites to live. So that's regards to lifestyle changes. The next step is medical management, and you did mention antihistamines, and certainly there's a big role in antihistamines in managing allergic rhinitis. However, there are other solutions. So, for example, when it comes to surgery, I try to break down patient symptoms into a blocked nose, allergy symptoms such as eye itching, eye watering, sneezing, nasal itching, and finally a runny nose. So if you do have a really blocked nose, we can do a very simple procedure where we shrink the lining of your nose or shrink the turbinates in order to improve your nasal breathing. And there's a few other procedures where I can put little stents into your nose, for example, in order to improve your breathing. Now, this is symptomatic improvement. With regards to a runny nose, there's a really good procedure where I can freeze the nerve at the back of your nose. It's called cryotherapy. And this will prevent your nose from running as much. And in my practice, this has worked wonders for patients. Now, the only long-term cure for allergic rhinitis is desensitization with immunotherapy. And once again, I provide the service, and it's very simple. Think of it as microdosing to a specific allergen. So, for example, if you're allergic to dust, I can microdose you with a little tablet that goes under your tongue on a daily basis. It'll give you little doses of dust. And eventually, after 3 years, your body would have built a response so it does not act in an allergic fashion. So we call it a change of the mechanism of action. So it changes from an allergic reaction to a non-allergic reaction. And that's sort of the breakdown of all the treatments available for allergic rhinitis.
And what impacts have, climate change and environmental pollution and urban pollution had on the severity and frequency of allergic rhinitis symptoms?
This is a really interesting question and is very relevant, actually. Climate change and pollution have adversely affected the symptoms of allergic rhinitis in the population. Patients are suggesting and they're reporting longer allergy seasons and more harsh or stronger symptoms. With regard to climate change, the air is warmer, the temperatures are going up, the carbon dioxide levels are going up in the atmosphere, and this is producing longer pollen seasons as plants are producing more pollen. At the same time, with urban allergies and allergens and irritants increasing, this does sensitize patients' noses. So they're more sensitive to the allergens already in the air and they have worsening reactions. So in summary, patients are reporting and they feel like allergies start earlier, they last longer, and they are hitting harder than before.
Sorry, question number 5. What are the most common misconceptions that patients have about allergic rhinitis?
One big misconception is that allergic rhinitis is just a nuance. And in reality, it certainly is not. It is a chronic inflammatory condition that can significantly impact patients in terms of their ability to work, their work productivity, their sleep, their focus, and even their sinus and ear health. Another common mistake I've seen patients make is relying solely on oral or tablet antihistamines. People often overlook using nasal treatment because the common thing to do is to use tablet antihistamines. Where in fact, nasal treatment in the terms of a nasal steroid spray or a nasal antihistamine spray, or indeed a combination of both sprays, are actually the most effective long-term treatment for blocked nose and inflammation. Another important thing to remember in the treatment of allergies is that it's much better and works much better to take the medicines on a regular daily basis rather than at an ad hoc basis when your allergies are worse or when you have bad days. And finally, many assume that there's no surgical treatment available or no potential cures for allergies. And we did discuss this in the last treatment. We did discuss this in the last question, and there are treatments, surgical treatments available to improve the blocked nose, to improve a runny nose, and to help you breathe better. And there is a potential cure for allergies in the form of desensitization to a specific allergen.